All right, so today we're talking sciatic pain and any general back pain, but especially that sciatic pain relief since a lot of people are dealing with that. So the way to undo that with trigger point therapy is that we need to target the muscles that are tightening and causing these trigger points, aka knots, that are actually causing the symptom in the back. Because believe it or not, the sciatic pain or other general low back pain is the symptom. And the perpetrator of all that is actually tight hip flexors and tight hamstrings and calves. Reason being for most people is that we sit a whole lot in our society these days, and when we do so, that is a flexed position for those muscles. The hip flexors especially, with psoas being the dominant one, that's the number one that's pulling us into a crunched type position. Anytime our upper body's coming up or our legs are coming up, that's the number one doing the job. And so as we do that all the time and those knots, those trigger points form in those regions, it now causes the opposite side of the body to flex to try to pull us back into a proper posture. And if they're constantly flexed like that, they also form trigger points. And now as they're clamped down, especially on that back side of the body where that sciatic nerve will run and jump out from underneath the piriformis muscle in the upper butt, that will cause a lot of pain for people, even if it's not exactly sciatic sometimes, but just other nerves in the area, or if it really is that sciatic nerve that's being clamped down on. Either way, usually the number one cause is the hip flexors. So we're gonna show you that you should focus 80% of your time on the hip flexors and hamstrings and calves, and only 20% of it on the back. Most people do it in the opposite, and they will get short-term relief, but that doesn't last. If you really want to get to the root cause of it all, you gotta target these sit muscles that are getting flexed and pulled short. So this is what we're gonna do. You can use whatever ball is best for you. Start with a softer ball, like a tennis ball, and if you can handle that level of pain, work your way up to denser balls. So we have everything from golf balls and high bounce balls, 35 millimeter or so, to street hockey balls, lacrosse balls, baseball, softballs, yoga tune-up balls, even a ball of onyx that I love, but that's only for, the denser you get, that's only for like your experience with it, and you can handle it in that area, and it's usually like a bigger, broader section of muscle, not this tiny, more delicate area, because you can, cause some damage if you're not listening to your body and only doing enough work. And the easiest way to gauge that is on the pain scale of 1 to 10. You shouldn't go past a 6. It should be a hurt so good range of 4 to 6. And then otherwise, if it goes up to 7, 8, 9, it should be brief, intermittent transitions, and that's about it. But just trust yourself and your body and do what feels right. Another good option for a tool for all this is some sort of thing like this. This is the Back Buddy, there's the Theracane and a few others, but just things that allow you to put it on a certain site and then push forward with it, or do the exact opposite, and you can dig into those hip flexors and push back, whatever you want to use. There's no wrong way to get at a trigger point, just utilize what makes the most sense for you, and I personally kind of mix it up between a lot of them. So we're going to go ahead and start with this lacrosse ball. You put it literally right under your sit bone, and it'll be a nice little like, whew, all right, that's a all of a sudden pain out of nowhere. So that's where you'll start, is right underneath that sit bone, and then you'll just slowly work your way back and let it literally just come down the hamstring and into the calf. And you'll find multiple sites along the way, and you just sit on one site for a little bit, focus on your breathing, because how you breathe is what's going to kick you out of fight or flight. So through the nose to the bottom of the lungs, nice and slow, and out slower than you inhaled. Breathe like that as you do all trigger point therapy to allow the muscles to release, soften, and elongate, and let you get more out of your work. But otherwise, you just keep moving back, and you can just sit there on these sites, or then while also sitting there, you can move whatever body part is attached to it. And then once you do the hamstrings, which you can also do while you're driving, something that we have to do often driving or sitting in our chair at work, you can be doing some trigger point work while you're doing that to help counter it in the moment. But the most important area to focus is the hip flexor. So the hip flexor region is quite a broad area. It's literally, the psoas, like we mentioned, is the number one. So that can come all the way up here on either side of the midline, and you'll find trigger points all the way down and into the hip flexor region, and then where it attaches up and under where it hits your femur, right next to your sit bone. So any of those areas are going to be perfectly fine for targeting, but otherwise you just simply want to start by laying with that ball on either side or both at the same time in that region, and then you can just over time move body parts while you're pushing on that area, come into more like sphinx-like poses or into an upward facing dog-like pose, whatever it is that you can currently handle. Work your way up as you go, and then same thing when you're on that site, you can now kind of inch your body forward or backward to allow the ball to travel to the interconnected trigger points in the area. But that is the goal, is just for 5 to 10 minutes a day, no more than 5 minutes on one spot, but otherwise it's a consistency thing that gives you the best results. Just start in that central hip flexor region and under the body, and then only do a couple minutes on the back where you actually put it right at that line of the sacrum and lumbar back, right on the waistband, and just lay on it and then inch your way forward, backward, side, rotate around. You'll find the areas that hurt the most, but only 20% of the time on the low back like that, 80% on the hip flexors and the back side of the legs. That will be what will give you this lasting relief, because all you're going to do is bring blood flow to those areas, allowing the muscle to finally let go the clench it's been stuck in, and by doing so, when muscles return back to their normal length, now they stop pinching on all the nerve endings in the area and yanking on anything that it shouldn't be yanking on. So that's the simple idea for it. I promise if you do this consistently for just 5 to 10 minutes a day, then within days to weeks, long-term injuries that you took decades to get to that point can be reversed. We do it regularly in our trigger point therapy massages that my wife and I help people with. If you need more detailed instruction, do not hesitate to reach out to us. We're happy to help. Just overall though, trust your body, trust yourself. Don't go too hard. Don't put yourself in unnecessary levels of pain. But this is a proven way to get yourself out of chronic back pain, especially sciatic pains that you're dealing with all the time. And this is how you built them up over time. So hopefully this made sense. And if you got any other questions, please don't hesitate to ask. Like I said, we're here to help. All right. Thank you so much. Have a good day.